everyone. Ready for a deep dive into something we all care about? Heart health it is. You've sent in a stack of articles, government websites, even some health blogs, so I'm guessing you want to go beyond the typical eat your veggies advice.
And that's great because honestly, there's so much more to heart health than most people realize. It's not just one thing. Even reliable sources can oversimplify it.
I'm already sensing this is going to be eye-opening.
Yeah.
Speaking of which, that CDC report you sent, wow. Heart disease is the leading cause of death in the U.S. 1 in 5 people. That's a lot to wrap our heads around.
It really is, and that's why we're starting here. Heart disease itself isn't a single condition. It's more like a whole category. Think coronary artery disease, arrhythmia, heart failure, congenital defects. We're talking a whole spectrum.
So it's like saying fruit at the grocery store, tons of choices within that one word.
Exactly. And each type of heart condition, like each fruit, has its own quirks, causes, symptoms, how it plays out. It's all different, which makes figuring out what's going on and how to treat it much more complex.
Okay, that makes the high numbers make more sense. But this makes me even more curious about those silent cases you hear about. Having heart issues without any obvious symptoms, that's scary.
And it's why early detection is so important. Some conditions are sneaky. No big warning signs right away. Regular checkups are key, even if you feel perfectly healthy.
Got it. Checkups are on the to-do list. But for those of us who like to play health detective, what are some warning signs we shouldn't ignore? When do we call for backup, so to speak?
Let's start with the classics. Chest pain, especially if it's heavy, like pressure or squeezing. But it doesn't always stay in your chest. It can radiate to your arms, jaw, back, even your stomach. Then you've got shortness of breath, fatigue that seems to come out of nowhere, irregular heartbeat.
Irregular heartbeat, check. Ooh. What about swelling? One article mentioned that, but it seems more like a sprained ankle thing.
It can be misleading, which is why we're mentioning it. See, heart failure, which itself can be caused by other heart conditions, often shows up as fluid retention. If your heart isn't pumping well, fluid builds up, often in the legs and feet first.
Huh. That's unexpected. But it makes a weird kind of sense, like when you realize your home's plumbing is connected to the electrical system.
Exactly. And while we're on the topic of less obvious symptoms, we have to talk about angina. One of your sources, the Mayo Clinic, describes it as feeling like somebody is standing on your chest. Pretty vivid, right? Angina is basically chest pain from reduced blood flow to the heart itself.
Ouch. Yeah, I'll pass on that experience. But this whole silent threat thing, it makes you wonder what causes all these different problems in the first place. Is it the same culprit every time, or is it more complicated?
It's definitely more complicated. Just like symptoms vary, the causes of different heart issues are all over the map. But there are these common risk factors that pop up again and again, like recurring characters in a medical drama. Think of them as ingredients in a recipe. The more you have, the higher your chances of a problem. And like with recipes, sometimes it's the combination, not just one thing, that really tips the scales.
All right, so give us the rundown. What ingredients should we be on the lookout for?
Well, some ingredients we can't control, like age. The older we get, the more wear and tear our hearts go through. And then there's family history. If your parents or siblings have heart disease, that bumps up your risk too.
So even if I swap out the sugar for honey, if my family recipe still calls for a stick of butter, my heart's not off the hook.
Great analogy. It's about the whole picture.
Okay.
Now on to things we can control. And this is where it gets interesting. Smoking, that's a big one. Like pouring poison right onto your heart. Damages blood vessels, raises blood pressure, messes with cholesterol.
And sticking with our food theme, I'm guessing a diet full of processed stuff and sugary drinks is like using the cheapest, most inflammatory oil you can find.
You got it. A diet high in saturated and trans fats is a major culprit in atherosclerosis. That's when plaque builds up in your arteries, like they're getting clogged, making your heart work harder to push blood through.
Yikes. And lack of exercise is like forgetting to preheat the oven. Things don't cook right if you don't get moving.
Another good one. Physical inactivity is a huge EGE risk factor. Your heart's a muscle. It needs exercise to stay strong, just like any other muscle.
Okay, so age, family history, smoking, bad diet, no exercise. What else is on this recipe for disaster?
Oh, plenty more. Obesity is a big one, often tied to those diet and exercise factors, but it puts extra strain on your heart and goes hand in hand with other risks like high blood pressure and high cholesterol. Speaking of which...
Ah, yes, the silent killers. You might not even know you have them until it's too late.
Exactly. High blood pressure means your heart's working overtime to pump blood, which can damage arteries over time. And high cholesterol, that's the stuff that builds up, forms plaque, and can eventually block those arteries.
It's like the more we learn, the more interconnected it all is. Not just one thing, but this whole web of factors.
You've got it. And one of the sources you sent mentioned a fascinating study about stress and heart health. People who are chronically stressed are at a higher risk of heart disease.
Stress, seriously. So my job, IS, trying to kill me.
Not necessarily, but it's a good reminder that mental health is just as important as physical health. We've got to take care of both.
Okay, that's a lot to digest. Before I have a stress-induced panic attack, let's switch gears to what we can do about all of this.
Absolutely. Knowledge without action isn't very helpful, is it? Let's talk prevention.
Okay, so we've covered the what, the why, the scary stats. Hit me with the good stuff. What can we actually do to protect our hearts? Besides, not aging and picking better parents, which isn't really an option.
Right. Would those be handy options? But seriously, there's all that you can do. It boils down to lifestyle choices.
Okay.
Which might sound daunting, but it's also empowering. You have more control than you think.
All right, I'm all ears. Where do we even begin?
The foundation.
Oh.
Diet.
Yeah.
I know everyone's always talking about diet, but there's a reason. What you eat directly impacts your heart.
Yeah.
We're talking about less processed foods, sugary drinks, unhealthy fats, and more. Fruits, vegetables, whole grains, lean proteins.
Okay, so far so good. But any specific diets? I remember one article mentioned the Mediterranean diet being good for your heart.
You've got good memory. The Mediterranean diet does consistently show up in research as heart healthy. Prioritizes healthy fats, fiber, antioxidants from all those colorful fruits and veggies. And it's not just what you eat, but how you eat. Enjoying meals with others, taking time to savor your food, that all contributes to a healthier lifestyle.
So ditch the drive-through, channel my inner Italian chef. Got it. What about exercise? How much are we talking? Marathon training isn't really my thing.
It doesn't have to be. Most recommendations, like from the American Heart Association, say aim for at least 150 minutes of moderate intensity exercise per week.
150.
Sounds like a lot, but it's just over 20 minutes a day.
Okay, that's doable.
And moderate intensity doesn't mean you have to be gasping for air.
So brisk walking, dancing, chasing my dog around the park, those count.
Absolutely. It's about finding things you enjoy, something sustainable. And even small bursts of activity throughout the day, they add up.
Good to know. I can work with that. What about those other risk factors we talked about? Smoking, weight, blood pressure, cholesterol. Those feel tougher to tackle.
They can be. But the good news is, lifestyle changes are huge for managing them. Quitting smoking is probably the single most important thing you can do for your heart.
Yeah.
Incredibly hard, I know, but there's tons of support out there.
For sure. And I'm guessing maintaining a healthy weight ties back into the diet and exercise stuff.
Exactly. It's all connected. Even losing a small amount of weight can make a big difference, especially if you have other risk factors like high blood pressure or diabetes.
Speaking of which, diabetes seem to come up a lot in these articles. Is that just a coincidence, or is there a real link there?
Definitely not a coincidence. Diabetes and heart disease are closely linked. See, diabetes affects how your body uses glucose, which is basically the sugar your cells use for energy.
Okay, keeping up so far.
So with diabetes, either your body isn't making enough insulin, which lets glucose into your cells, or it can't use insulin properly. And over time, that high blood sugar from diabetes, it damages your blood vessels, the ones that supply your heart included.
So it's like the sugar is messing up the heart's plumbing system.
Exactly. This damage makes you much more likely to develop heart disease even younger.
Wow. So if you do have diabetes, managing it well is even more important for your heart.
Non-negotiable. Keeping your blood sugar in a healthy range through meds, diet, exercise, it's crucial.
And what about managing high blood pressure and cholesterol? Those seem trickier.
They can be, but again, lifestyle changes make a huge difference. And even if you need medication, which many people do, making those changes can actually make your medication work even better.
Teamwork. Your body and the meds, fighting the good fight. Love it. Okay, this has been a lot of info. I'm feeling more informed, but also maybe I should schedule that checkup sooner rather than later.
No need to panic. Knowledge is power, right? You're now equipped to have more informed conversations with your doctor. Ask the right questions. Make proactive choices.
That's a great point. I'm already feeling more in control, less intimidated. Before we wrap up, anything else we should mention? Any surprising connections, lesser known heart health facts that came up in these articles?
Several articles mentioned a link that might surprise you. It's the connection between oral health and heart health.
Wait, really? My dentist and cardiologist should be comparing notes.
Not quite. But there's growing evidence that poor oral health, particularly gum disease, is linked to a higher risk of heart disease.
Okay, that is surprising. How does that work? Are they sharing toothpaste or something?
Not that direct. The theory is that inflammation in your gums, which is what gum disease is all about, can release bacteria and other inflammatory stuff into your bloodstream.
And those little troublemakers can then travel to the heart and cause problems.
Exactly. It's still being researched, but it shows how interconnected our bodies are and how important a holistic approach to health is.
So brushing and flossing, not just about a sparkling smile, but a healthier heart too. That's a good note to end on.
It is. Everything we've talked about, diet, exercise, managing those risk factors, it all ladders up to this bigger picture of overall well-being.
Love that. It's not just about avoiding heart disease, it's about living your healthiest, most vibrant life. Well said.
Couldn't have said it better myself.
Well, there you have it, a deep dive into the world of heart health. We've covered a lot, from understanding the different types of heart disease to those sneaky risk factors. But most importantly, you're now armed with actionable steps to protect your most vital organ.
And remember, this is just the beginning of your journey to better heart health. Keep learning, keep asking questions, and keep those conversations going with your healthcare providers.
Stay curious and take care of your heart. Until next time, deep divers.